Hello and welcome, Gold viewers from around the world. I'm Kristen Schwarz, licensed midwife and MC here for Gold. And today I have a very special guest with me. I'm chatting with Professor Welma Lubbe. Hi, it's so good to have you here, Welma.
Hi, Kristen. Thank you for having me. I'm very excited to join.
You are part of our Gold Neonatal online conference of 2025, and your topic is really exciting: optimizing preterm infant positioning, enhancing neurodevelopmental outcomes in neonatal care. We're going to talk about that in just a brief moment. Tell us a little bit about yourself first. Where in the world are you?
I live in South Africa, and more specifically in Potchefstroom. It's a small town which is also regarded as a city, actually, but it goes through more like a town. It's a student town, so a lot of training happening here, a lot of hospitals, and we are next to the Mooi River, so it's a beautiful area in which we live.
Oh, beautiful. And now tell us a little bit about your professional background. You're a professor, of course, and you work in the neonatal care unit. So tell us a little bit about your background and your work.
Indeed. I'm a midwife by heart, a midwife specialist in South Africa with neonatal nursing training as well. I like to refer to myself as a neonatal midwife because I like the baby part of maternity. And of course, the neonatal unit, the preterm babies, they're very close to my heart. So I got involved with them when I started working and specializing. And I realized that these babies belong to the parents, but we as healthcare professionals, we tend to say it's our babies that are in the units. And then someday we decide, now you must go home. And then suddenly we give the babies to the parents and they don't know what to do with them. So that's how I got involved with the preterm babies within the neonatal environment.
Oh, beautiful. Thank you for sharing that. Yeah, it is so true. And often these little ones, they need, quite a few medical interventions. They're hooked up to, machines and such. And it can be quite overwhelming for parents too, because they are very fearful of not to do anything wrong. But as you said, the parents are the experts on their baby. So how do you integrate care so the parents are really part of the team?
I think that's one of the most challenging things in the NICU environment, but also the most rewarding. So my research is about neurodevelopmental care, and that is really bringing the parent in as part of the team, being a stakeholder, being the primary caregiver. So that for me is very important. We need to center around the parent and their baby, because at the end of the day, it's not the baby of the hospital or the healthcare professionals. It's
Mhm.
the baby of the parents, and we need to empower them, like you say, so that they can then look after their baby, both in the hospital and when they go home.
Mhm. We learn a lot about neurodevelopmental care in recent years. Can you define that a little bit for us? What does that mean in the NICU context?
Sure, I think I want to take it down even a notch more than the formal academic definition. For me, developmental care is really putting the baby back into the womb.
Mm.
Because the premature baby and our full-term babies, they lost quite a bit of time in the womb where they would have the ideal environment for the ideal and optimal development and the right stimulation at the right time, right for that baby. So what we want to do with developmental care when these babies are born and in the NICU or in the labor ward is to make sure that the environment is as close as possible to what they would have had in utero.
And that's where positioning comes in, right? Your presentation is titled
Absolutely.
Optimizing Preterm Infant Positioning, Enhancing Neurodevelopmental Outcomes in Neonatal Care. So walk me a little bit through about this positioning aspect, because, you are talking about creating the womb, right?
Mm. So we know that the moms don't get issued with a womb that's this big, and then the baby need to grow into it. So the womb is tiny and it's a nice snug fit for the baby. So at the same time, it's providing the baby with nice, soft, comfortable boundaries that gives a feeling of security.
Mhm.
But it also then provides the baby with some space to explore in. And the womb just do that for the baby. But then they get born and they come into the world, whether it's a full-term baby or in the NICU environment, and they're exposed to everything that is not optimal for their development. So we want to try and position them back into the environment which would have calmed them. So positioning is helping the baby to develop on a muscle level, if you want, on a skeletal level. It also helps the baby to develop on a self-regulatory and a behavioral level, but it also helps to develop co-regulation between mum and baby. Because skin to skin care, for example, is a very important way of doing the correct positioning. So we're going to prevent a lot of complications, but we're also going to kickstart the baby and make sure that the programming in how they should develop and how they should interact with their world is correct if we
Mhm.
can have correct positioning for them in the NICU.
Yeah, and you talked about, the wonderful, how wonderful the womb is, right? Like it not only provides a safe environment, but also an environment that is quite sensory, right? Like they have
Yes.
experiences in the womb, they can taste, they can feel, they can move around. So in your aspect there in neurodevelopmental care, how do you create that kind of environment? I can imagine skin to skin is one of those because there is
Mhm.
the warmth of the parent, the skin, the feel of the skin, the smell. So walk me through a little bit of what you see there.
I think it's important to understand that the baby goes through a sequence of sensory development in the womb, starting with touch as early as 8 weeks, moving on to vision that develops very last in the womb at 36 weeks. Because before then they can't constrict the irises. So any light is overexposing for the baby. Now,
Mhm.
if we take that then to the NICU environment, then we need to know where is this baby in their sensory development. So if
Mhm.
they're very young, we need to know we need to protect their eyes. If they're 36, 37 weeks, then we know, okay, so maybe the eyes are important, but we can give them a bit more stimulation with regards
Mhm.
to how much light we have in the unit. So we need to change the light. We need to have day and night rhythms. We need to position them in different ways so that they can start to learn, is it nighttime and is it daytime? And even with that, if we talk about positioning and we talk about sensory stimulation, what are they lying on? Is it this hard hospital linen,
Mhm.
which feels like sandpaper, or
Right.
is it something nice and soft? What blankets do you use over them? Is it again nice and clean but hard? Or is it nice and soft and providing the baby with the right kind of stimulation? How do we touch them when we pick them up? Do we
Mhm.
do it with a nice firm pressure that they feel the same pressure that they had in the womb? Or do you only do this poking and prodding and the painful stimuli in our
Mm.
babies? So our sensory environment plays a role in everything that we do for these babies.
Oh, absolutely fascinating. I can't wait for your presentation, Welma. It sounds so wonderful. So many wonderful tools you will give us there and so much to learn. Now, before I let you go, what are your final words to our audience? What are you hoping the audience will learn from your presentation and take away?
I hope I can share my passion for premature babies and restoring the parenting role and putting the parents at the center of the care of their baby. When we talk about positioning in this instance, this is one mechanism that we can use, but that we can really see how these things, all of them interlink. And at the end of the day, we want optimal development for babies as well as their parents.
Thank you so very much. It was so wonderful having you here with me today, getting to know you a little bit, your work, and also, of course, talking about the presentation here at Gold. Thank you so much.
Thank you, Kristen.
And now some information for our viewers. The presentation Optimizing Preterm Infant Positioning, Enhancing Neurodevelopmental Outcomes in Neonatal Care is part of our Gold Neonatal Online Conference of 2025. It's just around the corner. We have a keynote presentation that is open access and free to all, starts at June 3rd. So to find out about the keynote and of course this wonderful presentation here and the entire conference, we invite you to go to goldneonatal.com. Thank you all for watching, and I hope to see you all at the conference. Bye-bye, everyone.